These are times that I'm concerned about more than ever. The next 2 weeks are critical.
Good evening. Trying times, but we're in it together. Utah's governor reinforcing his message that we are in the thick of the COVID-19 pandemic. And we have plenty of developments to get to tonight, including new guidance on Americans wearing face masks in public. Also, popular recreation spots in Utah shutting down ahead of a traditionally busy spring weekend. We start with the best look we've received to date on just how prepared our state is for what may be coming. News specialist Mike Headrick is looking into the logistics of treating all those people at the peak of the pandemic. Mike, in some cases we're in good shape, but in others not so good at all.
Yeah, let's talk about some of the good shape, because the first thing today we heard from Utah's general in this fight on COVID-19, in this war, this battle as they're calling it. We heard for the first time today the general, fresh out of retirement, General Jefferson Burton, highlighting the good, the bad, and the ugly.
Based on the studies and the graphs, we believe we will have sufficient ventilators as well in Utah.
Some good news today from General Jefferson Burton, newly in charge at the Utah Department of Health. Hard numbers were released addressing Utah's preparedness for the peak of coronavirus cases. Starting with ventilators, Utah has just under 1,000, with 72% of them currently unused and ready for COVID-19 patients. ICU beds, we have 600 statewide. General Burton, along with University of Washington data, estimates at the peak of the virus, Utah will need 284 ICU beds, meaning if we stay on this track, Utah will have enough. But there are still critical issues in treating COVID-19.
The area that we're struggling with, and it's changing daily, is PPE, personal protective equipment.
PPE like N95 masks. We need 3.6 million of these. We only have 165,000 with 3 million on order. Utah will need an estimated 4.6 million hospital gowns. We currently have 61,000. And face shields, 2.2 million will be needed, but Utah has only received 76,000. They're being distributed daily to facilities that need them. Another announcement today, the establishment of alternate care sites for hospital overflow. Jess Anderson with the Department of Public Safety says the first site is up and ready to go with 250 beds, but these are for non-coronavirus patients.
It is important to note that alternative care site is not for COVID-19 patients. The COVID-19 patients would remain in our main hospitals.
Now, nationwide, we're hearing a lot about ventilators, shortage of hospital beds. Now, those are the things right now here in Utah we feel pretty good about. But it's the PPE, the personal protective equipment, that we need so desperately at this point. I'm Mike Headrick, live at 5.